I'm a primary care specialist and a disaster risk reduction management in health practitioner. I am your resource person for Module 12. Module 12 is entitled Pandemic and Disaster Response, the Role of Schools. Our objectives are as follows. For key school personnel involved in disaster risk response, we would like to ensure proper understanding of the interplay between disaster and pandemic response and public health in the Philippines, especially in the context of school health. Our objectives for the non-allied health professionals is to contextualize the role of the schools in disaster and pandemic risk reduction and management in the broader community, and to emphasize shared responsibility for risk communication during disasters and pandemics. The role of the school in pandemic and disaster response is not exactly mentioned explicitly in the National Disaster Risk Reduction and Management Plan, or the NDRRMP. The NDRRMP, however, states that different agencies may be recruited in initiatives relative to the restoration or expansion and strengthening of economic activities pre and post disaster. There is likewise a resolution approving the Rehabilitation and Recovery Planning Guide by the NDRRMC, and it states that a key outcome of DRRM is ensuring that restoration and strengthening of education, health, and social protection should be ensured following disasters and recently following pandemics. The National Disaster and Risk Reduction and Management Framework ensures that disaster preparedness is inculcated or included in basic education and the National Service Training Program and in bachelor's education. And the Comprehensive Disaster Risk Reduction and Management in Education Framework is the policy that established the three pillars of disaster management in education, which is hinged on safe learning facilities, school disaster management, and disaster risk reduction in education. We will zero in our discussion, first part of our discussion rather, on this framework. The Disaster Risk Reduction and Management Service, or DRRMS, is the DepEd's focal and coordination unit for disaster risk reduction and management, or DRRM, and climate change adaptation, or CCA, and education in emergencies. This unit was created to Department Order Number 50, Series of 2011, in line with the mandate of Republic Act 10121, or the National Disaster Risk Reduction and Management Act. This department order empowers the DepEd personnel, offices, schools, and learners in ensuring safety and learning continuity. It also institutionalizes DRRM, CCA, and education in emergencies and strengthen the resilience of basic education in the context of natural and human-induced hazards. This is the DRRM in Basic Education Framework. This is based on the Sendai Framework and in the provisions and in the thematic pillars of Republic Act 10121, which are prevention and mitigation, preparedness, response, rehabilitation, and recovery. The vision of DepEd. What does it mean for DepEd's learners and personnel? It means that all offices, schools, learners, and personnel are safe and resilient to risks and impacts of disasters and emergencies, and now to include pandemics arising from natural, such as biologic agents like COVID-19 and human-induced hazards. The outcome is to reduce risk and impacts of these natural and human-induced hazards not only to DepEd offices, schools, but also to the learners and the school personnel and teaching staff. There are three immediate intermediate outcomes that has been identified. Intermediate outcome number one, learners and personnel are protected from death, injury, and harm or disease brought about by natural and human-induced hazard. An intermediate outcome number two is to ensure that there is a learning continuity in the aftermath of a disaster or in the current case of a pandemic. And intermediate action number three is that education investments are protected from the impacts of natural and human-induced hazards or threats. The 6-year strategic goals of DepEd's uh, disaster management strategic plan are as follows. Number one, it aims to institutionalize DRRM, CCA, and emergencies in education across all levels of the department, from the central office all the way to the smallest school in every island of the Philippines. Likewise wants to establish a package of coordinated interventions which are quickly delivered to ensure the continuity of learning and resilient recovery. Let me focus on this: establishment of coordinated interventions which are quickly delivered to ensure the continuity of learning and resilient recovery. These are very timely goals in the light of the COVID-19 pandemic. The impact of COVID-19 in schools was a big challenge to ensure continuity of learning, but DepEd was able to rise to the challenge by shifting to distance learning and virtual learning and hybrid learning. COVID-19 pandemic was unprecedented, and it has presented many challenges to students, educators, and parents who were not ready to cope with the demands of a pandemic in our midst. Pandemics heretofore was unknown for all of us. The Philippines, though we are a country that is very prone to natural disasters, is very resilient in terms of sudden onset and natural hazards or disasters like typhoons, earthquake, and the like. But the pandemic was something out of the books. It has disrupted learning, and its broad impacts on child development physically, mentally, emotionally, and socially is yet to be ascertained. Studies have shown that a lost year of schooling comes at the price of learning. Thus, DepEd and the national government and all other sectors really pushed for reopening of schools in the soonest possible time. And here are our recommendations for the safe reopening of schools. Number one, there should be strict, proper wearing of recommended PPE for teachers, school staff, and students in accordance with national and local guidelines. There should be enhanced sanitation and hygiene measures to include frequent cleaning, disinfection of frequently touched surfaces, and general sanitation of the school environment. We need to ensure adequate and appropriate ventilation, especially in enclosed and shared spaces, and we need to monitor air quality and adhere to recommended standards as based on evidence. Next, we also need to ensure adequate physical distancing. Thus, we need to limit the number of learners in every classroom. One strategy could also be to shorten school hours so as to limit the time of interaction between the teachers and between and among students to the minimum. We also need to establish policies for disease surveillance and set criteria for temporary closure in the event of an outbreak as a last resort. We also need to establish good communication channels and information sharing mechanisms between the school, the home, and the community. The preponderance of fake news should also be addressed. Thus, risk communication in schools is very important. What is risk communication? It is a very broad discipline which includes social media, mass media, and direct stakeholder engagement. It is a practice hinged on trust, and critical elements to it is an understanding of stakeholder perceptions and the ability, as I've mentioned, to fight fake news. Let me give you some examples on how risk communications may vary according to context. For example, in disaster preparedness, if there is a volcano within 10 kilometers and there is an alert for notice of emergency evacuation at all times, this type of communication is less urgent in tone, but it must drive a sense of caution. And please note that action points are always clear. For disaster response, if there is a need to evacuate the area and to proceed to the evacuation site, this type of communication must be short, precise, easy to understand, and can be quickly transmitted or broadcasted. There has to be drills in order for the students and the other teaching staff and administrative staff in the school to respond properly once this call is made. In pandemic recovery, how do we help our students, our teachers, and our staff cope with the loss of a family and a friend? This is quite difficult. We need to give them avenues to find health, counseling services. Where are they available? And this type of communication must be sensitive to the grief that the person affected by the disaster or by the pandemic is experiencing. And it must focus on diminishing the adverse impacts of the disaster event or the loss in the family or loss in the community. In the pandemic response, to give an example, in addressing vaccine hesitancy, the key message should be vaccines are safe and effective in preventing severe disease. And again, this type of communication must be short, precise, easy to understand, and can be quickly transmitted or broadcasted within the community. In the presence of a disease outbreak, the key message is to prevent further spread by early isolation of cases and quarantine of contacts. And this type of communication must be urgent in tone, but and must drive a sense of caution, but should be sensitive to issues of data privacy, mindful and respectful, but action points must be clear. There are, so, there are also certain issues that we should be sensitive to during risk communication or disaster preparedness. Issues like sexual and reproductive health, substance abuse and addiction, violence within the family are but just some examples. So as we end this session, I hope that I was able to impart the need to institutionalize DRRM, the CCA, and education in emergencies across all levels of the Department of Education. I hope I was able to emphasize the need for coordinated interventions in order to ensure the continuity of learning and resilient recovery. Schools, as demonstrated, have an important role in pandemic and disaster resilience. Thank you for your kind attention.